Hi everyone, and welcome to RN Explains. I'm so glad you're here today. Our bodies are incredible, complex machines, and understanding how they work can empower us to take better care of ourselves. Today, we're going to demystify a crucial part of our health, our kidneys. We'll explore their vital functions and, most importantly, break down 3 key lab values that help us assess kidney health: BUN, creatinine, and GFR. My goal is to make this information clear, understandable, and reassuring, whether you're a patient, a caregiver, a student, or just curious about your health. Let's dive in and learn together. Our kidneys are 2 bean-shaped organs, each about the size of a fist, located just below the rib cage, one on each side of your spine. They might be small, but their role in maintaining our overall health is absolutely enormous. Think of them as the body's sophisticated filtration system. Their primary and most well-known function is to filter waste products from our blood. Every day, your kidneys process about 120 to 150 quarts of blood, removing waste and extra water to produce about 1 to 2 quarts of urine. This process is essential for keeping our blood clean and our body functioning properly. Beyond just waste removal, kidneys also filter excess fluids from the blood. This helps to regulate our blood volume and, consequently, our blood pressure. Without this fluid balance, our bodies could become overloaded, leading to serious health issues. But the kidneys do so much more than just filter. They play a key role in maintaining electrolyte balance. Electrolytes like sodium, potassium, and calcium are vital for nerve and muscle function, hydration, and maintaining the body's pH levels. The kidneys carefully regulate these levels, ensuring they stay within a healthy range. Another critical function is producing hormones. Yes, your kidneys are mini hormone factories. They produce erythropoietin, which stimulates red blood cell production in the bone marrow. They also produce renin, which helps regulate blood pressure, and they convert vitamin D into its active form, which is essential for bone health and other vital body functions. So, as you can see, healthy kidneys are fundamental to a healthy life. They are constantly working behind the scenes, performing multiple life-sustaining tasks. Understanding these roles helps us appreciate why monitoring their function is so important. Given how vital our kidneys are, how do we know if they're working well? That's where lab tests come in. When your doctor wants to check on your kidney health, they often look at a few specific markers in your blood. Today, we're going to focus on 3 key lab values that provide a comprehensive picture of kidney function: blood urea nitrogen, or BUN, creatinine, and glomerular filtration rate, or GFR. These 3 values, when considered together, offer valuable insights into how effectively your kidneys are doing their job. Let's break down each one, starting with BUN. First up is blood urea nitrogen, commonly known as BUN. This lab test measures the amount of urea nitrogen in your blood. But what exactly is urea nitrogen? Urea is a waste product that's formed when your body breaks down proteins. When you eat protein, your liver processes it, and one of the byproducts of this process is ammonia. Ammonia is toxic, so your liver converts it into a less harmful substance called urea. This urea then travels through your bloodstream to your kidneys, where it's filtered out and excreted in your urine. So, a BUN test essentially measures how much of this urea nitrogen is circulating in your blood. A normal BUN level indicates that your kidneys are effectively filtering this waste product. However, if your BUN levels are high, it can indicate several things. One common cause is dehydration. When you're dehydrated, your kidneys don't have enough fluid to properly filter and excrete urea, causing it to build up in your blood. Think of it like a clogged drain. If there's not enough water flowing through, the waste accumulates. High BUN can also be a sign of kidney problems. If your kidneys are damaged or not functioning efficiently, they won't be able to remove urea from your blood as effectively, leading to elevated levels. A high-protein diet can also temporarily increase BUN levels because there's more protein being broken down, producing more urea. Other causes might include certain medications, heart failure, or gastrointestinal bleeding. On the other hand, low BUN indicators are less common and usually less significant in terms of kidney health. They might be seen in cases of severe malnutrition, where there isn't enough protein intake to produce urea, or in advanced liver disease, where the liver isn't able to convert ammonia into urea efficiently. However, for kidney assessment, high BUN is generally the more concerning finding. It's important to remember that BUN levels can fluctuate based on various factors, including your hydration status, diet, and even certain medications. That's why BUN is often looked at in conjunction with other kidney function tests, especially creatinine, to get a more complete picture. Now let's talk about creatinine, another crucial marker for kidney health. Creatinine is a waste product that comes from the normal breakdown of muscle tissue. Every time your muscles move, they produce creatinine. Unlike BUN, which can be influenced by diet and hydration, creatinine levels are generally more stable and are considered a more reliable indicator of kidney function. This is because creatinine is produced at a relatively constant rate, depending on your muscle mass, and it's almost entirely filtered out of your blood by your kidneys. So, if your kidneys are working well, they efficiently remove creatinine from your bloodstream, and your blood creatinine levels will remain within a normal range. However, if your creatinine levels are high, it's a strong indication of impaired kidney function. When the kidneys aren't filtering effectively, creatinine builds up in the blood because it's not being cleared as it should be. This can be a sign of kidney damage or disease. The higher the creatinine level, generally, the more significant the kidney impairment. It's worth noting that factors like muscle mass can influence creatinine levels. For example, a very muscular person might naturally have slightly higher creatinine levels than someone with less muscle mass, even with healthy kidneys. Similarly, certain medications can affect creatinine levels. This is why doctors always interpret lab results in the context of your overall health, medical history, and other tests. Low creatinine indications are less common and usually not a cause for concern regarding kidney function. They might be seen in individuals with very low muscle mass, such as the elderly, or those with certain muscle-wasting conditions, or in cases of severe malnutrition. The relationship between BUN and creatinine is also important. Doctors often look at the BUN to creatinine ratio. An elevated BUN with a normal creatinine might suggest dehydration, while both elevated BUN and creatinine often point more directly to kidney dysfunction. This combination helps healthcare providers differentiate between various causes of abnormal lab results. Understanding creatinine helps us move closer to the most important measure of kidney function, which is our next topic, the glomerular filtration rate, or GFR. The glomerular filtration rate, or GFR, is often considered the single most important measure of kidney function. While BUN and creatinine give us clues, GFR provides a direct estimate of how well your kidneys are actually filtering your blood. Think of the glomeruli as tiny, intricate filters within your kidneys. The GFR estimates how much blood passes through these filters each minute. It's not measured directly, but is calculated using a formula that takes into account your blood creatinine level, age, sex, and sometimes other factors like race. This calculation provides a very good estimate of your kidney's filtering capacity. The interpretation of GFR is straightforward. A higher GFR indicates healthy, well-functioning kidneys. This means your kidneys are efficiently clearing waste products from your blood. A GFR of 60 or higher is generally considered normal. Conversely, a lower GFR suggests that your kidneys are not filtering as effectively as they should be. This can be a sign of kidney damage or disease. The lower the GFR, the more significant the kidney impairment. GFR values are particularly important because they are used to stage chronic kidney disease, or CKD. This staging helps doctors understand the severity of kidney damage and plan appropriate treatment. Let's briefly go over the stages of chronic kidney disease based on GFR values. Stage 1 CKD means you have kidney damage with a GFR of 90 or higher. At this stage, your kidneys are still filtering well, but there's evidence of damage, perhaps protein in your urine. Stage 2 CKD indicates kidney damage with a GFR between 60 and 89. Your kidneys are still filtering reasonably well, but the damage is progressing. Stage 3 CKD is divided into two parts. Stage 3A is a GFR between 45 and 59, and Stage 3B is a GFR between 30 and 44. At this stage, kidney function is moderately to severely reduced, and symptoms may start to appear. Stage 4 CKD means a GFR between 15 and 29. This indicates severe reduction in kidney function, and you'll likely be preparing for kidney failure. Finally, Stage 5 CKD is a GFR less than 15. This is considered kidney failure, meaning your kidneys have lost almost all their filtering ability and you will need dialysis or a kidney transplant to survive. Understanding your GFR is crucial for monitoring kidney health over time. Regular GFR checks can help detect kidney problems early, allowing for interventions that can slow the progression of kidney disease. It's a powerful number that gives both you and your healthcare team a clear picture of your kidneys' performance. We've covered a lot today, from the incredible work your kidneys do to the meaning behind BUN, creatinine, and GFR. Remember, these lab values are powerful tools that help us understand your kidney health. If you receive lab results that show concerning BUN, creatinine, or GFR levels, please don't panic. The most important actionable advice is to consult with your doctor. They are the best resource to interpret your specific results in the context of your overall health, medical history, and any other symptoms you might be experiencing. They can explain what the numbers mean for you and discuss any necessary next steps, which might include further testing or lifestyle adjustments. The good news is that there are many things you can do to support your kidney health and potentially prevent or slow the progression of kidney disease. Here are some key lifestyle tips. First, stay hydrated. Drinking enough water helps your kidneys flush out waste products more efficiently. Aim for clear or light yellow urine. Second, maintain a balanced diet. Focus on fresh fruits, vegetables, and lean proteins. Limit processed foods, which are often high in sodium and unhealthy fats. Third, manage your blood pressure and blood sugar. High blood pressure and uncontrolled diabetes are two of the leading causes of kidney disease. Work with your doctor to keep these conditions well managed through diet, exercise, and medication if needed. Fourth, limit your salt intake. Too much sodium can increase blood pressure, putting extra strain on your kidneys. Read food labels and choose low-sodium options. Finally, be mindful of medications, especially over-the-counter pain relievers. Non-steroidal anti-inflammatory drugs, or NSAIDs, like ibuprofen, can harm your kidneys if used excessively or for prolonged periods. Always follow dosage instructions and consult your doctor if you use them regularly. Taking these proactive steps can make a significant difference in maintaining healthy kidneys for years to come. Your kidneys work tirelessly for you, so let's give them the care they deserve. Thank you for joining me today on RN Explains. I hope this information has been helpful and empowering. Remember, knowledge is power when it comes to your health. RN Explains Simple, Smart Science.